Imagine like your medical records turning into a crystal ball, predicting, future health risks and
Wow.
guiding you kind of towards personalized treatments.
Okay.
That's the potential of combining electronic health records with machine learning AI.
Right.
And that's exactly what we're diving deep into today.
Yeah.
We're going to be exploring how this powerful duo is changing healthcare as we know it.
Absolutely.
And a huge thank you to London HeartbeatsZ Academy
Yes.
for supporting this deep dive.
Yeah.
They have like over 150 courses
Wow.
on health and tech.
Cool.
So if you're intrigued by what we're discussing today, you should really check them out.
Yeah.
And don't forget to follow them
Okay.
on Facebook, Instagram, Spotify, and YouTube
Right.
for free updates.
Cool.
You won't want to miss their amazing content or future discussions.
Awesome.
But for now, let's jump into this deep dive
Well.
on EHR and machine learning AI.
Sounds good.
Where do we even begin?
Well, I think it all starts with understanding real world data.
Okay.
Or RWD.
RWD.
Yeah, and this isn't like just data from clinical trials.
Right.
It's information gathered from like diverse real world medical settings,
Okay.
revealing valuable insights about how medicines work in everyday practice.
So it's like getting a glimpse into the effectiveness and safety of treatments outside the controlled environment
Yeah.
of a research study.
Yeah, exactly.
That seems incredibly valuable.
It is. It is.
And where's all this data even coming from?
Well, the sources are incredibly diverse.
All right.
We're talking electronic medical records, insurance claims, health surveys, patient registries,
Okay.
data from wearable devices, lab results, mortality data,
Wow.
even social media.
It's like piecing together a giant global health puzzle.
Right.
Using data from every corner of the healthcare system. It must paint a much more complete picture than relying just on clinical trials.
Precisely. Precisely.
But having all this data,
Mm-hmm.
it's only useful if you can,
Yeah.
make sense of it.
Yeah.
How do we go from this raw data
Right.
to actionable knowledge?
Well, that's where real world evidence comes in.
Okay.
Or RWE.
RWE.
Yeah, and RWE is it's derived from analyzing that raw RWD,
All right.
turning those data points into meaningful and applicable insights.
So RWE is like the aha moment,
Right.
the clear understanding we get after analyzing all that data.
Yeah, exactly.
So what is this process of transforming data into evidence? Like, what does that look like?
It's a multi-step process.
Okay.
First, we have to process data from these diverse sources
Okay.
using methods like chart audits, data abstraction, and quality assurance checks.
Right.
We also use machine learning and natural language processing to sift through like vast amounts of information.
It sounds like a highly complex process.
It is. It is.
It demands both human expertise and cutting-edge technology.
Absolutely.
And this process data,
Yeah,
it has to meet stringent standards
it does.
to be considered reliable
Right.
for research,
Mm-hmm.
regulatory submissions, and clinical applications.
Yeah, it has to be high quality, complete, transparent,
Okay.
generalizable, timely, and scalable.
This RWE
Yeah,
seems incredibly valuable for drug development.
it is.
Where does it fit into that process?
Well, RWE plays a vital role at practically every stage of drug development.
Okay.
In early clinical development, it helps researchers characterize unmet needs and discover novel targets for therapies.
So even before a new drug is even created,
Right.
RWE helps researchers identify areas where new treatments are needed.
Exactly.
And then as the drug progresses,
Yeah.
RWE informs decisions around clinical trial design,
Right.
feasibility, and even assists in the execution of these studies.
Absolutely.
So it's like having an informed roadmap
Yeah.
for drug development,
Yeah.
helping researchers design better studies and potentially bring new treatments to patients more efficiently.
Absolutely. Absolutely.
And even after a drug is developed,
yeah,
RWE doesn't stop there.
it doesn't.
It's critical for regulatory submissions, post-marketing commitments, tracking patient outcomes over time,
Right.
and understanding real-world treatment patterns and their effectiveness.
It's a game changer.
Yeah.
With the potential to accelerate the delivery of safe and effective therapies.
To handle all this data,
Right.
we need a system that
Yeah.
can store and manage it effectively.
Right.
That's where electronic health records, or EHRs, come into play.
You got it.
EHRs.
Yeah. Think of an EHR as a digital version of a patient's paper chart,
Okay.
but with superpowers.
Right.
It's a structured way to collect a patient's health information electronically,
Okay.
and importantly, can be shared across different healthcare settings.
So if you see a specialist, they can access your medical history
Yes.
from your primary care physician
Right.
without starting from scratch.
Exactly.
That seamless transfer of information seems crucial for coordinated care.
Exactly.
And sharing information efficiently across different healthcare providers
Oh yeah.
is one of the major advantages of EHRs.
Absolutely.
It also enables research
Yeah.
on larger populations,
Yeah.
something that would be impossible with paper charts.
Right.
Imagine trying to manually extract data
Oh yeah.
from millions of paper records.
Right.
I can only imagine the logistical nightmare.
For sure.
So EHRs aren't just about storage.
Right.
They're about making information accessible and usable.
Exactly.
What makes up this treasure trove of data?
Within an EHR.
EHRs have two main components.
Okay.
Structured data and unstructured data.
Okay.
Structured data is the easily analyzable information organized in fields, such as demographics, diagnosis codes, lab test results,
Okay.
medications prescribed, and procedures performed.
So the structured data
Yeah.
is like a well-organized spreadsheet
Right.
of your health information.
Exactly.
What about unstructured data?
Yeah.
What does that look like?
Unstructured data is the free text information
Okay.
that doesn't fit neatly into predefined categories.
Okay.
Think of the detailed notes from your physician or nurse consultation reports or discharge summaries. This data is rich in detail,
Okay.
but requires natural language processing,
Okay.
or NLP,
NLP to unlock those valuable insights. So NLP is like teaching computers
to understand and analyze human language.
Yes.
The nuanced way we communicate in healthcare settings,
Precisely.
and EHRs, particularly when combined with pathology reports,
Right.
are often called the GPS of healthcare,
Yeah.
guiding diagnosis, treatment, and overall patient care.
Absolutely.
That makes sense.
Yeah.
Having that comprehensive overview of a patient's health history
Right.
feels crucial for making informed decisions.
Yes, it is.
But diagnosis isn't always straightforward.
It's not. No.
How do the complexities of diagnosing diseases
Yeah.
play into this world of data and technology?
That's a key point
Yeah.
in medicine.
Yeah.
We often use the term phenotype
Okay.
to describe all the observable characteristics of a disease.
Okay.
And phenotype often exists on a spectrum,
Okay.
encompassing everything from like physical signs and tumor markers to disease grade and severity.
So it's not always a clear-cut yes or no.
Right.
When it comes to diagnosis, can you give some examples of diseases
Here.
that exist on a spectrum like this?
Absolutely.
Yeah.
Take stroke, for example.
Sure.
It can manifest in different ways with varying severity and impact.
Okay.
Lung cancer is another example with different subtypes and stages that influence prognosis and treatment.
Okay.
And autoimmune diseases like rheumatoid arthritis also present with a range of symptoms and severities.
So how does this complexity of diagnosing diseases on a spectrum impact treatment decisions?
Well, it means determining the precise cut points for the presence or absence of a disease can be challenging.
Right.
And this has major implications for treatment.
Right.
A correct diagnosis is paramount.
Okay.
It guides prognosis, risk assessment, and ultimately determines the best course of action.
So a misdiagnosis,
Yeah.
either in clinical practice or research, could have serious consequences for patients.
It can. Misdiagnosis can lead to delayed or even inappropriate treatment,
Right.
impacting patient outcomes.
And in research, misclassification can skew our understanding of a disease.
Yes.
Impacting the development of new therapies.
Right.
And our knowledge of risk factors and potential side effects.
Exactly.
That's a sobering thought.
It is.
How does artificial intelligence or AI
Yeah.
fit into this this complex world of diagnosis and treatment?
That's a great question.
Yeah.
AI, specifically machine learning, holds immense potential to improve diagnostics, navigate those gray areas we discussed, and guide more effective treatment decisions.
AI and machine learning are often used interchangeably, but I imagine there are distinct differences.
There are.
So what are those?
So artificial intelligence is a broad term encompassing any system capable of performing tasks that typically require human intelligence. Machine learning is a subset of AI, focusing on training mathematical models to predict outcomes using data.
So it's like teaching computers to learn from experience.
Exactly.
Just like we do as humans.
Yeah, machine learning algorithms can learn from data, abstracting rules and identifying patterns. In a way similar to how a physician gains knowledge during their training.
That's fascinating.
It is.
What factors determine the best machine learning model for a specific task?
The characteristics of the data are crucial. If you're working with a limited number of unique data points, you might use classical techniques like linear regression or decision tree methods. Which essentially segment data based on predefined rules.
It seems like there's a whole toolbox.
There is.
Of machine learning techniques.
There's.
And medical data comes in all sorts of formats.
It does.
So how do you choose the right tool for the data?
You're absolutely right.
Yeah.
The type of data is a key consideration. For example, if you're working with images like histopathology slides or radiography images, convolutional neural networks are particularly effective.
What about data that tracks changes over time? Like in longitudinal studies, I imagine that requires a different approach.
Absolutely.
Yeah.
For that type of data, we use time series analysis. Think about tracking changes in a patient's condition over time to help inform adjustments to their treatment plan.
And how do we make sense of descriptive data, like demographics or even the narrative information gathered from patient interviews?
That type of data often lends itself to natural language processing or other techniques designed to extract relevant information from unstructured text.
It seems like there's a specific machine learning tool.
There is.
For every type of data in healthcare.
There is.
Can you break down the main categories of machine learning?
Absolutely. There are three main types: unsupervised learning, supervised learning, and reinforcement learning in unsupervised learning. The algorithm searches for patterns and relationships in the data without any explicit guidance.
So it's like giving the computer a puzzle and letting it figure out how the pieces fit together.
Exactly.
Without giving it like the picture on the box.
Exactly. Supervised learning involves training the algorithm on labeled examples. Think of it as showing the computer a bunch of images and telling it which ones are cats and which ones are dogs.
So it's learning by example.
Exactly.
Being guided by the labels we provide.
Precisely. And then there's reinforcement learning. Where the algorithm learns through trial and error, being rewarded for good decisions and penalized for bad ones. It's a bit like teaching a dog new tricks with treats and praise.
That's a great way to visualize it.
Yeah.
So how are these machine learning models like developed and applied in the real world of healthcare?
It starts with gathering both structured and unstructured data from electronic medical records. Then we process that data, often using techniques like natural language processing to extract meaning from unstructured text.
So it's like giving the computer a medical textbook. And then teaching it to read and understand a patient's chart.
That's a great analogy. Next, we train a classification algorithm on a subset of this data called the training set. Think of it as a crash course in medicine for the computer, using real patient data.
And after the algorithm is trained, how do we know it's ready to be used with real patients?
We validate it on a separate subset of the data called the validation set. This is like the computer's final exam in medical school, ensuring it can accurately predict outcomes on new data.
And if it passes, it's ready to enter residency and start helping us make decisions about patient care.
The validated algorithm can be used to predict outcomes on new patients, assisting with diagnosis, treatment decisions, and even predicting disease risk.
That's incredible.
It is.
Could you give us some specific examples of how machine learning is already being used in clinical practice?
One area where machine learning excels is in medical ultrasound. Ultrasound imaging is widely used. But it can be subjective and operator dependent. Machine learning can help improve the accuracy and efficiency of ultrasound imaging, particularly in challenging areas like staging liver fibrosis and classifying thyroid nodules.
So it's like having an extra set of expert eyes. Analyzing the ultrasound images, like with the physician.
Exactly. And another area where machine learning is making a huge impact is cancer care. Machine learning models can help predict cancer susceptibility, recurrence, and even survival.
That could be game-changing.
It is.
For cancer screening and early detection. Imagine being able to identify individuals at high risk of developing certain cancers. Or predict the likelihood of recurrence after treatment.
Exactly.
That's incredible.
That is.
Early detection and personalized treatment are just the tip of the iceberg.
Absolutely.
It sounds like machine learning is already having a significant impact.
It is.
But I imagine there are also challenges to implementing this technology in healthcare.
Absolutely. One of the biggest challenges is selecting training data sets that are both representative and unbiased. The data used to train the algorithm must reflect the diversity of the patient population.
So if the data is skewed, it's like teaching the computer based on a biased textbook, potentially leading to inaccurate or even harmful conclusions.
Exactly. If the training data isn't representative, the resulting models may perpetuate existing inequalities or even create new ones.
That's a critical point.
It is.
Ensuring fairness and equity in healthcare AI has to be a top priority.
Absolutely.
And another challenge lies in establishing a clear and reliable gold standard for training and evaluating these algorithms. We need a robust and unbiased benchmark against which to measure the performance of these models. And it seems like the rapid evolution of medicine itself is another hurdle. New discoveries and treatments are constantly emerging.
Exactly. Machine learning models need to be dynamic and adaptable, capable of incorporating new information and evolving with the ever-changing landscape of medicine. They can't simply be static snapshots of our current knowledge.
So it's like giving the computer a continuing medical education program, making sure it stays up to date.
Exactly.
With the latest advances.
Lifelong learning is critical for both human physicians and AI systems.
And finally, we have to carefully consider the division of responsibility. Yes. The age-old question.
The big one.
Who's ultimately responsible for the decisions? The human clinician or the AI?
It's a complex ethical and practical question. That requires careful consideration.
It seems like finding the right balance.
It is.
Between human expertise and the power of AI is crucial.
It's essential.
This has been an incredible journey into the world.
It has.
Of EHRs and machine learning AI.
It's fascinating, isn't it?
We've covered so much ground.
Oh, yeah.
From understanding real-world data to the nuances of developing and applying machine learning models.
It's clear that EHRs and machine learning are transforming healthcare, offering unprecedented opportunities to improve diagnosis, treatment, and overall patient care.
It's an exciting time.
It is,
but also a time for thoughtful conversation, and careful consideration.
Absolutely.
As we navigate this new frontier.
It is a new frontier.
I'm curious what excites you most.
Yeah.
About the future of EHRs and machine learning.
What excites me most is the potential to personalize healthcare. Like never before.
Yeah.
Imagine a future where treatment plans are tailored to each individual's unique genetic makeup, lifestyle, and environmental factors.
That's a powerful vision.
It is.
For the future of medicine.
It is.
What are your thoughts?
I'm incredibly excited about the potential for early disease detection and prevention. Imagine a world where we can identify individuals at high risk of developing certain diseases and intervene early to prevent them from ever manifesting.
That would be truly revolutionary.
It would be.
I'm also incredibly optimistic about the potential to reduce healthcare disparities and improve access to quality care for everyone, regardless of their background or location.
I share that enthusiasm.
Yeah.
It's inspiring to imagine a future where geography, socioeconomic status, and other factors no longer determine access to the best health care.
That's a future worth striving for.
It is.
But as we've discussed, realizing that future requires careful planning, collaboration, and open dialogue.
Absolutely.
This deep dive has been incredibly insightful.
It has.
Providing a glimpse into the exciting world.
It is exciting.
Of EHRs and machine learning AI.
It's a fascinating field.
I hope our listeners feel inspired to delve deeper into this topic.
I hope so too.
And engaging conversations about the future of healthcare.
I agree.
The future of healthcare is being written right now.
It is.
And we all have a role to play.
And speaking of shaping the future, let's shift our focus to the specific ways that machine learning is being used in healthcare today. We've already touched on its role in medical ultrasound and cancer care. But there's so much more.
I'm eager to hear more.
Yeah.
What other areas are being revolutionized by machine learning?
Personalized medicine is one area generating immense excitement. Imagine a future where treatment plans are tailored to your individual genetic makeup. Lifestyle, and even your environmental exposures.
It sounds like the ultimate goal of healthcare.
It is
treating each person as the unique individual they are, not just applying a one-size-fits-all approach.
Exactly. Machine learning is helping to turn that vision into reality. By analyzing vast amounts of data, from genomic information to lifestyle choices and environmental factors. AI can help identify patterns and predict which treatments are most likely to be effective for you.
It's like having a personalized health advisor. Powered by AI, helping you navigate the complexities of medical decisions. But how do we ensure this personalized approach doesn't overlook the individual needs and preferences of the patient?
That's an important consideration. While AI can provide valuable insights, it's crucial that the final decision-making process remains a collaborative effort between the patient and their healthcare provider. AI should be used to empower, not replace human judgment and the patient-doctor relationship.
That makes a lot of sense.
It does.
It's about harnessing the power of AI while preserving the essential elements of human connection and personalized care.
Absolutely.
What other exciting applications are on the horizon?
Predicting disease risk is another area where machine learning is making significant strides by analyzing your personal data and comparing it to vast data sets. AI can identify potential health risks before they even manifest, opening the door for early interventions and preventative measures.
That's incredible.
It is.
Catching diseases in their earliest stages, when they are most treatable, could dramatically improve outcomes.
Absolutely.
And even save lives.
Precisely.
And machine learning isn't limited to individual patient care. It's also being used to improve population health outcomes.
Yes.
That sounds fascinating. How does the machine learning impact public health on such a large scale?
By analyzing large-scale data sets, AI can help identify trends and patterns in disease outbreaks. It can track the spread of infectious diseases, helping public health officials respond more effectively, and potentially even predict future health crises.
It's like having a global health watchdog, constantly monitoring and analyzing data to keep us safe from widespread threats.
Exactly.
And it's not just about reacting to crises.
It's not. Machine learning can also be used to develop more effective public health interventions and policies, proactively promoting well-being and preventing diseases across entire populations.
That's incredible.
It is.
It seems like machine learning has the potential to touch every aspect of healthcare, from individual patient care to global public health initiatives.
It's true. And we're only just beginning to scratch the surface of what's possible. As these technologies continue to evolve, we can expect even more innovative applications in the years to come.
That's incredibly exciting.
It is.
But as with any powerful technology, there are also potential downsides. Things we need to be cautious about.
We do.
Yeah.
You're absolutely right. It's crucial that we develop and deploy these technologies responsibly and ethically. One of the biggest concerns revolves around the potential for bias in AI algorithms.
Can you elaborate on how bias can creep into AI algorithms and what that means for healthcare?
So bias can arise from the data itself. If the data used to train an algorithm isn't representative of the population as a whole, the resulting model might perpetuate existing inequalities, or even create new ones.
So if you were to train an AI algorithm on data primarily from one demographic group, the results might not be accurate or effective for people from other backgrounds.
Exactly. That's why ensuring diversity and inclusivity in the data used to train AI algorithms is absolutely essential. Otherwise, we risk creating systems that exacerbate existing health disparities rather than alleviating them.
It sounds like careful attention to data quality and representation is paramount. What other ethical considerations do we need to be mindful of as we venture further into the world of AI-driven healthcare?
Privacy and data security are paramount. Healthcare data is incredibly sensitive, and protecting patient privacy is non-negotiable. We need robust systems in place to safeguard this information.
It's easy to imagine that with all this data being collected and analyzed, there could be temptations for misuse by companies or even governments.
You're right. Robust data governance frameworks, clear guidelines and strict regulations are absolutely essential to ensure that patient data is used responsibly, ethically, and solely for its intended purpose.
It's reassuring to know that these considerations are at the forefront of the conversation. What other potential pitfalls should we be aware of?
Another concern is the potential for algorithmic decision making to erode patient autonomy. If we rely too heavily on AI to make decisions about diagnosis and treatment, patients might feel like they're losing control over their healthcare journey.
That's a valid concern.
It is.
It's crucial to ensure that patients understand how AI is being used in their care, and that they feel empowered to participate in the decision-making process.
Absolutely. Transparency and open communication between patients and their healthcare providers are crucial in this evolving landscape. We need to emphasize that AI should be used as a tool to support clinical decision-making, not to replace human judgment or the invaluable patient-doctor relationship.
It sounds like finding the right balance.
It is.
Between leveraging the power of technology and preserving the human touch is key.
Exactly. It's not about choosing one over the other. It's about integrating them in a way that benefits both patients and clinicians.
So how do we navigate these ethical challenges and ensure that AI is used responsibly and ethically in healthcare?
What steps can we take to ensure a positive and equitable future for AI in medicine? Open dialogue and collaboration are key. We need to bring together diverse voices: patients, clinicians, researchers, ethicists, policymakers, and even technology developers to discuss these complex issues and work together to develop guidelines, regulations, and best practices that promote responsible AI development and deployment.
It sounds like a multidisciplinary approach is essential.
It is.
It's not just a technological challenge. It's a societal one.
It is.
That requires thoughtful consideration from all stakeholders.
Exactly.
And it's an ongoing process as these technologies continue to evolve. We need to remain vigilant and adapt our approaches to ensure that AI is used ethically and for the benefit of all.
This has been a truly enlightening discussion.
It has.
We've explored not only the incredible potential of EHRs and machine learning to revolutionize healthcare, but also the crucial ethical considerations and potential pitfalls we need to be mindful of.
But it's important to remember that this is not just an abstract technological discussion. This is about real people's lives.
Yes, it is.
And the future of healthcare for everyone.
You're absolutely right. At the end of the day, it's about using technology to improve human health and well-being.
And it's about empowering patients, supporting clinicians, and creating a more equitable, efficient, and effective healthcare system for all.
Beautifully said. I couldn't agree more.
This has been a truly insightful deep dive into the world of EHRs and machine learning AI.
A fascinating field.
We've only scratched the surface of this vast and complex topic.
It is a vast topic.
But I hope it's sparked curiosity.
I hope so too.
And inspired our listeners to think critically about the future of healthcare.
I agree.
There's so much more to explore. There is.
And I encourage our listeners to delve deeper into this fascinating field.
It is fascinating.
And engage in thoughtful conversations about the role of AI in shaping the future of healthcare.
Absolutely.
The future of healthcare is not predetermined.
It's not.
It's being shaped right now. And each and every one of us has a role to play.
And speaking of shaping the future, let's talk about some of the specific challenges and opportunities that lie ahead.
Okay, I'm all ears.
Okay.
What are some of the key hurdles we need to overcome as we move forward?
One of the biggest challenges is data interoperability.
Okay.
Right now, EHR systems often operate in silos, making it difficult to share data between different healthcare providers.
Right.
This fragmentation hinders our ability to create large,
comprehensive data sets, which are essential for training accurate and effective machine learning models.
So it's like trying to solve a giant jigsaw puzzle.
Yeah.
When you only have a few pieces from each section.
Exactly. To realize the full potential of machine learning in healthcare.
Right.
We need to find ways to break down these data silos and create seamless data exchange between different EHR systems.
Yeah, that sounds like a complex undertaking.
It is.
Requiring collaboration and coordination across the entire healthcare ecosystem.
It is.
But it's an essential step.
It is.
If we want to build truly robust and comprehensive AI system that can benefit everyone.
Absolutely.
Another key challenge we need to address is the need for more robust data governance and privacy protections.
Of course. With all the sensitive health data being collected and analyzed, we need to ensure it's handled responsibly and ethically.
Absolutely.
We need clear guidelines and regulations that safeguard patient privacy and dictate how this data can and cannot be used. We also need to develop technologies that can preserve privacy while still allowing for data sharing and analysis.
That sounds like a delicate balancing act.
It is.
Harnessing the power of data, while ensuring that individual privacy is protected.
It is.
But finding that balance is crucial.
It is.
If we want to build a future where AI is used responsibly and ethically in healthcare.
We've talked about data interoperability and privacy. What other technical challenges need to be addressed?
One of the biggest technical hurdles is the need for more explainable AI.
Explainable AI.
Yeah.
Many current machine learning models are like black boxes.
Okay.
They work.
Right.
But we don't always understand why they make the decisions they do.
So it's like having a magic wand that produces incredible results.
Right.
But you have no idea how it works or why it's doing what it's doing.
Exactly.
And that lack of transparency can be a problem in healthcare.
Yeah, it can be.
Right.
Clinicians need to be able to understand the rationale behind an AI-driven recommendation.
Okay.
If they're going to trust it and incorporate it into their decision-making process.
That makes perfect sense. Blind trust in any technology, especially when it comes to healthcare decisions, is never a good idea.
It's not.
So how do we make AI more transparent and explainable?
It's an active area of research. Okay. And several promising approaches are being developed. Right. One approach is to design models that can generate explanations for their predictions, essentially showing their work and making their reasoning transparent.
So it's like asking the AI to show its work to justify its conclusions. Yeah. Just like we would expect from a human clinician.
Exactly. Yeah. Another approach is to develop new types of machine learning models that are inherently more interpretable. Okay. These models may sacrifice some predictive power. Okay. But they gain transparency and understandability.
So it's about finding the right balance.
It is.
Between accuracy and explainability.
Precisely.
And recognizing that different applications might require different levels of explainability. Right. A model designed to predict the risk of of developing a chronic disease, for example.
Yeah.
Might need to be more explainable than a model used to classify images for diagnostic purposes.
Yeah, that makes sense.
Right.
The level of transparency should align with the stakes of the decision being made.
We've discussed some of the key challenges.
We have.
But what about the opportunities?
Yeah.
What aspects of the future of EHRs and machine learning are you most excited about?
One area that I'm particularly excited about is the potential for AI to personalize healthcare, like never before. Imagine a future where treatment plans are tailored to each individual's unique genetic makeup, lifestyle, and environmental factors.
That's the holy grail of healthcare, isn't it?
It is.
Treating each patient as a unique individual, not just applying a one-size-fits-all approach.
Exactly. And machine learning is making that dream a reality by analyzing vast amounts of data from genomic information to lifestyle choices and environmental factors. AI can help identify patterns and predict which treatments are most likely to be effective for you.
It's like having a personalized health advisor, powered by AI, helping you navigate the complexities of medical decisions. But how do we ensure this personalized approach doesn't overlook the individual needs and preferences of the patient?
That's an important consideration. While AI can provide valuable insights, it's crucial that the final decision-making process remains a collaborative effort between the patient and their healthcare provider. AI should be used to empower, not replace human judgment, and the patient-doctor relationship.
That makes a lot of sense.
It does.
It's about harnessing the power of AI while preserving the essential elements of human connection in personalized care.
Absolutely.
What other exciting applications are on the horizon?
Predicting disease risk is another area where machine learning is making significant strides. By analyzing your personal data and comparing it to vast data sets, AI can identify potential health risks before they even manifest, opening the door for early interventions and preventative measures.
That's incredible.
It is.
Catching diseases in their earliest stages when they're most treatable could dramatically improve outcomes.
Absolutely.
And even save lives.
Precisely.
And it's not just about individual patients.
No, it's not.
Machine learning is also being used to improve population health outcomes.
Yes.
That sounds fascinating.
Yeah.
How does machine learning impact public health on such a large scale?
By analyzing large-scale data sets, AI can help identify trends and patterns in disease outbreaks. It can track the spread of infectious diseases, helping public health officials respond more effectively, and potentially even predict future health crises.
It's like having a global health watchdog.
Yeah.
Constantly monitoring and analyzing data to keep us safe from widespread threats.
Exactly.
But it's not just about reacting to crises.
No, machine learning can also be used to develop more effective public health interventions and policies, proactively promoting well-being and preventing diseases across entire populations.
That's so powerful.
It is.
It sounds like machine learning is truly revolutionizing every aspect of healthcare.
It is.
And it's only just the beginning.
It is.
As these technologies continue to evolve, we can expect even more. Innovative. This has been like an incredible deep dive exploring, the potential and the considerations around EHRs, machine learning, and healthcare. But I think it's time to kind of turn the conversation to you, our listeners. What role do you see yourselves playing in this evolving landscape? what excites you about these advancements and what concerns do you have?
Yeah, that's a crucial question. We've talked about the incredible potential of EHRs and machine learning to improve, diagnosis and treatment and even prevent diseases. But as we've also discussed, there are inherent risks with any powerful tool.
Exactly. And it's the responsibility of all of us, patients, clinicians, researchers, policymakers, even, technology developers, to ensure that these technologies are used ethically and responsibly. We need to be mindful of potential biases, fiercely protect patient privacy, and ensure that human judgment and compassion remain at the heart of healthcare.
It's a shared responsibility, and open dialogue is essential. And one of the themes that have resonated throughout this deep dive is the importance of data.
Yeah.
Data is the fuel that powers machine learning. It's the key to unlocking the potential benefits we've discussed.
Absolutely. But that reliance on data raises some important questions. Who owns that data? Who controls access to it? These are questions we need to address as a society.
Those are crucial questions right now. It feels like the Wild West out there in terms of data collection. Companies are gathering vast amounts of information about our health and habits. We need to have a serious conversation about data ownership and privacy and the ethical implications of using this data for research and commercial purposes.
I completely agree. And it's not just about protecting our data from misuse. It's also about ensuring that the data used to train these machine learning algorithms is representative and inclusive of the diverse population they are intended to serve.
That's a critical point. We need to be very careful that AI doesn't inadvertently exacerbate existing health disparities. We have to strive to ensure that everyone benefits from these advances, not just a select few.
That idea of inclusivity and representation extends to the field of AI development itself, doesn't it?
Absolutely. We need more diverse voices, women, people of color, people from different socioeconomic backgrounds involved in developing and deploying these technologies. Diversity leads to better science and more equitable outcomes.
That's so important. If we want AI to work for everyone, it needs to be created by a diverse group of people representing the populations it's intended to serve.
And that diversity of perspectives isn't just about fairness, it's also about innovation. Different people bring different ideas, different experiences, and different ways of seeing the world. That diversity of thought is the engine of creativity and progress.
That's a beautiful way to put it. So as we wrap up this deep dive into the world of EHRs and machine learning AI, I want to leave you, our listeners, with one final thought-provoking question. What kind of future do you envision for healthcare?
It's a question worth pondering, too. Do you envision a future where AI is seamlessly integrated into every aspect of healthcare, from diagnosis and treatment to prevention and public health? Or do you see a future where AI plays a more supportive role, augmenting human capabilities rather than replacing them?
There's no right or wrong answer, but it's a conversation we all need to engage in as we navigate this new frontier.
Absolutely. And it's a conversation that needs to involve everyone, not just the experts and policymakers. We all have a stake in shaping the future of healthcare.
I think that's the perfect note to end on. The future of healthcare is not something that's going to be decided for us.
Yeah.
It's something we are all going to create together through thoughtful dialogue, responsible development, and a commitment to equity and inclusivity. We can harness the power of technology to build a better, healthier future for everyone. Thanks for joining us on this deep dive.